Now let's talk about the diseases and conditions of the urinary system. Fats and sugars contain carbon, hydrogen, and oxygen. Waste products are carbon dioxide and water. So we breathe off the CO2 and we sweat. Okay. Proteins contain carbon, hydrogen, oxygen, and nitrogen, and they produce nitrogenous waste in the form of urea. Now, an average adult can hold approximately 2 cups of urine at any one time. 1 quart of blood passes through the kidneys each minute. 1/4 of our blood is in the kidneys at any one time. It cleans all the blood in our body once every 50 minutes. Now, this right here, this little area of indentation is called the ileum. It's what gives the kidney its bean shape, and it's where the renal artery enters the kidney. The renal vein, filtered blood leaves the kidney through the renal vein and flows back to the heart. The urethra in the female, it ends just above the vaginal opening, and in the male, it ends at the tip of the penis. When the bladder is full, nerve impulses are sent to the brain and the urethral sphincter relaxes. The kidney. They filter approximately 125 mils per minute of blood. Okay, now we have the cortex, which is the outer portion, and that's where you find the nephrons, and it's the filtering layer. The medulla is the collecting layer, okay? Tubes carrying filtered waste travel from the cortex through the medulla to the pelvis. Now, the minor and major calyces are small cup-like regions of the renal pelvis. The renal pelvis collects urine from the calyces, narrows into the ureter, then it goes into the bladder, then into the urethra. The nephron. So the kidneys produce urine by filtration. You have your efferent arteriole. This takes blood away from the glomerulus, and the afferent right here, arteriole, brings blood to the glomerulus. Okay. Now, a nephron is the glomerulus plus the renal tubule. Fluid travels from a low concentration to a high concentration, and this collecting duct right here leads to the renal pelvis. ADH, which is antidiuretic hormone of vasopressin, is released from the posterior pituitary. It regulates the extracellular fluid volume by affecting renal handling of water. Increased water reabsorption of the kidneys, and so it makes the urine more concentrated. Decreased fluid intake leads to dehydration, so blood is more concentrated, so it increases ADH, increases reabsorption. Increased fluid intake, blood becomes less concentrated, so you have decreased ADH, decreased reabsorption. And this is just another picture of the nephron. Okay. The urinary system is responsible for the production and elimination of urine. The kidneys help to regulate the water, electrolyte, and acid-base content of the blood and selectively filter out the waste products of metabolism. Terms associated with urinary tract signs and symptoms: hematuria, which is blood in the urine; pyuria, pus in the urine; proteinuria, protein in the urine; and dysuria, difficult or painful urination. Nocturia is an increased voiding at night. Oliguria, decreased urine output, and technically it's less than 500 mils per 24 hours. Anuria is no urine output or less than 100 mils per 24 hours. Frequency is frequent urination. Urgency is the sensation of needing to urinate immediately. Frequency is I gotta go all the time. Urgency is I gotta go now. The warning signs are high blood pressure, blood or protein in the urine, an elevated creatinine blood test, more frequent urination, particularly at night, difficult or painful urination, puffiness around the eyes, swelling of hands and feet, especially in children. Nephrotic syndrome, it's also called nephrosis. This is a condition of the basement membrane of the glomerulus. The basement membrane surrounds each of the capillaries comprising a glomerulus. It's characterized by severe proteinuria, which is severe protein in the urine, often to the extent the body cannot keep up with the protein loss. So you'll get hypoalbuminemia. Between 70 and 75% of cases result from some form of glomerulonephritis. The disease is further characterized by hyperlipidemia, lipiduria, and generalized edema. May also arise as a consequence of diabetes, lupus, neoplasms, or reaction to drugs or toxins. Edema is the most common symptom. There's a good prognosis for children. With adults, nephrotic syndrome is frequently a manifestation of a serious progressive kidney disorder or of a disorder elsewhere in the body leading to renal failure. Okay, so this is just a little cartoon that'll help show you the signs and symptoms. Infectious urethritis. This is a lower UTI or a urinary tract infection. It's an inflammation of the urethra, more common in males. Usual cause is an ascending bacterial invasion. May be bacterial, fungal, or viral. 80% of all UTIs are caused by E. coli. UTI may be secondary to septicemia. Infectious cystitis. This is a lower UTI as well. Inflammation of the urinary bladder. More common in females. It's actually 10 times more common. And this is because they have a shorter urethra, there's a greater potential for urethral exposure to bacteria, and males have antibacterial prostate secretions. The usual cause is an ascending bacterial invasion. So what that means that the infection starts at the urethra and moves up the urinary system. The other route is through the bloodstream. Pyelonephritis. This is an inflammation of the renal pelvis and connective tissues of one or both kidneys. This is more common in females, and it's also known as infective tubulointerstitial nephritis. Acute glomerular nephritis. Both kidneys are always involved. This is an inflammation and swelling of the glomeruli. Usually follows a streptococcal infection. It's marked by proteinuria, edema, decreased urine volume, and hematuria. It's also known as acute post-streptococcal glomerular nephritis. This is an allergic inflammation of the glomeruli caused by circulating antigen-antibody complexes that become trapped within the network of the glomerular capillaries. The antigen-antibody complexes are produced as a consequence of an infection elsewhere in the body. Chronic glomerulonephritis is a slowly progressive, non-infectious disease. It can lead to irreversible renal damage and renal failure, the advanced stage of many kidney disorders, and it's an inflammation followed by progressive destruction of the glomeruli. Polycystic kidney disease. Polycystic means many cysts. Kidney function is progressively impaired, leading to renal failure or uremia. This is a common type of kidney disease in which cysts are formed in the kidneys, and it's bilateral. Developmental defect of the collecting tubules in the cortex of the kidneys. Groups of tubules that fail to empty properly into the renal pelvis slowly swell into multiple grape-like fluid-filled sacs or cysts. Hydronephrosis. Collection of urine in the renal pelvis due to obstruction. Causes. Some of the causes are congenital defects, and you usually find this in children, strictures, which is a closure, kidney stones, tumors, and enlarged prostate. Of course, that's in the male. The distension of the renal pelvis and calyces of the kidney due to pressure from accumulating urine. The pressure impairs and may eventually interrupt kidney function. Okay, so you see the obstruction, and there's that hydronephrosis as the urine is building up. This is an IV urogram showing hydronephrosis in the right kidney. Of course, this is the right kidney. And an IV urogram is an X-ray exam with contrast of the urinary tract and includes the kidneys, ureters, and bladder. And actually, we're going to stop right there.